Welcome to this edition of Behind the Blue. I'm Cody Kaiser with UK Public Relations and Strategic Communications, and I'm joined this week by my colleague, Amy Timoney. We are in the 11th week, I believe, of our current at-home measures in dealing with the COVID-19 pandemic. During that time, we've produced a lot of content, communication to our students, faculty, staff, and community. We've taken major steps in putting together the early stages of a plan for our fall restart. Here to talk about that and more, we are joined today by the 12th president of the University of Kentucky, Dr. Eli Capilouto. Dr. Capilouto, thank you for being with us.
Well, always glad to be with you. Thank you.
First thing I want to ask is, what have the last few months been like for you personally?
I think personally, the challenges that we have met as a campus, personally are very gratifying to me. I always said from the day I got here, we were a remarkable place. We certainly got tested and indeed about how remarkable we are. And I think we've answered that call. Lots of stress, lots of strain, lots of bending. We haven't broken. And I think we've learned a lot about ourselves and used it in a positive way that will make us an even better university when we overcome this challenge and return to this reinvented normal, and then getting the virus behind us, hopefully with treatment and then vaccine. I think we'll use everything we learn to be better teachers, discoverers, healers. So even with the challenges, I remain encouraged. I'm very optimistic.
Well, I was going to ask about, you talked about the things we've learned. If you could break it down, what are some major takeaways or things that you think that you or we have learned or that the university has learned, and maybe look at that in certain sectors, like from our academic standpoint, from and the way we've handled things with classes, from housing to our medical campus. Like, what do you think some major takeaways that we've learned in this have been?
One major takeaway that I think cuts across almost everything we do now is how we can more effectively use technology. In some ways, we were forced into it, and it certainly has its limitations, but it has incredible benefits. And I think Dr. Newman says we had an 18-month plan to introduce telemedicine, telehealth. We did it in 5 weeks. And, we're getting up to tens and thousands of visits, which is working. There are ways to make it work better. So we've had it on that side. Certainly when it comes to teaching. And I'm already thinking, gee, what have we learned from this? And I say, when I say we, it's from a larger community, not just UK. I certainly talk to staff who are teachers during the day with children who are at home and what they're learning about teaching and learning. And they have ideas about how we can improve these things. I also recognize and deeply worried about the technology gaps here. Those households, those individuals who may not have the technology support, the sort of in-home provision of an education that we all think is going to be important in closing inequalities. So those are the kind of lessons we learn. And as a university, it's not just how we do things, it's how can we help the Commonwealth better achieve goals that are really common. A healthier Kentucky, a more educated Kentucky, a Kentucky with less income inequalities, health disparities.
Well, you have quite a background in public health. How How has that helped inform some of the decisions that you've made over the last few months and that your teams of administrators have made?
Well, first of all, team is the important word. I do bring a perspective in public health. I have some expertise, not expertise, but part of that for me was everything from epidemiology, health behavior, health administration, economics, statistics. I mean, what we're trying to do now is a community-based intervention. Even though we've learned a lot over the last several weeks about this virus, we still must resort to what we know works best. And that is hand washing, sneezing, coughing etiquette, sanitizing surfaces, wearing our mask, keeping our distance. A lot of that is behavioral change. But you can adjust the environment to make all those things easier for people to do and achieve. So that's what we're trying to address in terms of a restart. I do believe that bring that perspective to it. In many ways, I think I'm a generalist on this campus when you have the depth and breadth of disciplines, specialty areas and all, then you can turn to that expertise. And that's what we've done through the EOC and the different work streams. And you can synthesize the information and integrate it into an effective action.
You mentioned the restart. I guess just first of all, as we talk a little bit more about that, what is kind of the one thing that you want people to know right now about our plans for the fall?
I would say I mentioned to someone the other day, we're using a process of radical inclusion. We have over 500 people involved, maybe more. We have gone to our campus with potential plans, gotten incredible feedback. We'll go out there again and get more feedback. We'll come up with what I hope is a plan that I can look at every person that occupies this campus, and we're really in all 120 counties, but when I talk about the campus proper, that we've done everything we know to do that is practical and feasible to reduce their risk of becoming infected and sick from this virus or any other infectious disease. It'll have collateral benefits when we do all of these things, but that we've done everything we know that can work.
You talk about the people in different areas across campus. We really do have some outstanding people in some of these areas that are such a tremendous resource, from our medical campus to our research. We have people who are researching this, to our people who are working on the restart itself for the academic year, who really are just outstanding people in their particular areas of what they do.
It's great to see our most precious resource come to the forefront of all this. When you have somebody in a week's time using the Center for Membrane Research to say, gee, I can develop a more effective protective mask, not like N95 that keeps out 95% of certain particles and all, but maybe it can deactivate the virus immediately. To people who in our College of Design say, gee, we need a more protective mask. Let's use some 3D printing, work with producers in the Commonwealth so that we can ramp up production. Clinical trials underway, certainly. To be able to stand up a 400-bed hospital really in a week, to weaving together when our local schools closed, a way to provide childcare, daycare for all our employees, so our vital work could continue. to answer all the questions that are bubbling up over this, to see that our College of Business and Economics can do a nice study, peer-reviewed, already published in a top journal that says, what is the effect of all this social distancing and all that we do. So I am pleased and proud of all the disciplines that come to the forefront on this.
What would you say to members of our community who are concerned for their safety in terms of coming back and the steps that we're taking?
Yeah, I'd say we're all concerned. It's important to be concerned. We have used time, which is not always our friend, to do a lot and learn a lot. You realize that we emptied residence halls, flipped to online learning in a matter of days, constricted weeks, to keep everyone safe. We did flatten that curve in Kentucky. I hope everybody says, I was my brother and sister's keeper during all of this, and it mattered. I saved lives. You don't know which ones you saved because you were looking for non-events. They didn't happen, but believe me, we all did. And then we have learned, that social distancing works. We now know more about who should wear a mask, when you should wear a mask. We know that social distancing can work, and how we're going to configure spaces. So I think I am encouraged by our work, because I think there's also the recognition that it's certainly our physical well-being, being protected from a virus. But when you look holistically at our health, our mental well-being here, other diseases that if unchecked and unscreened have consequence, that if we don't have our healthcare system open for those who are at risk of other diseases because they fear this disease, then we're putting those individuals at risk. And how we say, how can we serve in a different way, a safe way? We've used that time well, and now we're trying to use it again to understand how to best open our campus. We have athletics opening in phases. We have research opening in phases. And we already have so much crosstalk underway that we're going to learn from those so that we can, step into something at a larger scale.
Why is it that a reinvented or reimagined normal is so important as we think about this coming fall?
I think that we have certainly learned that a residential experience, and that's not just for the people who live on campus, but are part of the campus community, can be a transformative experience. The technology has helped a lot. I can even imagine how this technology can be used in the future to improve the sort of residential experience. But nonetheless, relationships matter. People come here to understand more about themselves, understand about others who may be dissimilar from the neighborhood in which they are familiar or they grew up. And that is rich. So in some ways, we want to hold on to that, be able to offer it in a way that is beneficial but still safe as we work our way forward. So that reinvented normal is precious to what we do and what people, I think, value. It means we've got to be even better than before, though, because we can't offer the experience in the typical ways.
You talk about opening in stages and being taking a measured approach to it with athletics and with classes and things like that. I'm sure you've probably had conversations with parents and students and prospective students who have had concerns, what do you say to those family members, those kids that are looking forward to coming in the fall, or their parents? What do you tell them?
Well, you mentioned important community, but we also have our faculty and staff, and we have a deep responsibility to them and their safety and well-being. So we're considering all groups. You certainly have to recognize from what we've learned about the virus, some are at more risk than others, and there's certain things that need to be avoided and other precautions taken. There are going to be circumstances where contact with people who could possibly spread the disease have to be really minimalized. So we want to be able to offer what I would consider things in general, but also we have to customize, individualize our approaches. And I'm confident that technology and other means may allow us to do that. So that's what I want to tell people. We're going to be upfront. We're going to tell you what we can do. I think we have to recognize and say to everyone, there's not a place one can entirely go unless you disengage to the point where you don't see anyone, that you're not going to be at some risk. So we're going to do everything we know to do to reduce that risk. It will not be zero risk.
What do you think, as you look forward to the next few months and the process that we have ahead of us, what do you think are some of the biggest challenges to the process, to the university, both short term, but then also long term?
I think short term, to have this much behavioral change is a real challenge. I think the past few months, you can't turn on the TV, can't turn on the radio, can't listen to a podcast where you don't hear about these things. And so in some ways, I believe the knowledge about this has been raised. That awareness is going to be important. I think that what we're trying to do on campus is there's the active part you got to take in wearing a mask and distancing and so forth. But we want something that is passive. The way you enter buildings, enter rooms, exit rooms, minimize the distancing, where you may sit in a class, for instance. I had to go to see a physician last week. The waiting room had a limited number of spaces I could sit in, but I could see my physician, which was important. So those are the real challenges I see. And an analogy I've drawn is automobile safety. We drive a lot more today, but we have fewer fatalities than we did 20, 30 years ago. Matter of fact, your likelihood of dying in a crash today is 80% less per mile driven. And what did we do? We made the automobile more safe. You know, the technology in an automobile, you're too young to know what it used to be like, but seat belts, airbags, blind spot detection, all those kinds of things reduce the likelihood of a crash. And if there's a crash, the car is more protective and forgiving. The highway is safety. There used to be utility poles that if one hit, they wouldn't collapse, could result in severe injury. And then since I hear them fly over my house all hours of the day, I know that we have a modern emergency response EMT system where, a helicopter can evacuate someone with a serious illness to a facility like UK where the trauma center is outstanding. So those are the kinds of things we've done. And we've got to do all this in a compressed amount of time. We have more technology than we did back then. So how we use that to our benefit is going to be important. But I use that analogy to say you can make progress, you can make the environment safer, we can improve behavior, and we can re-engage, continue what we do in a reinvented normal, and still be safer.
You mentioned the helicopters and the hospital. We talk a lot about how, UK is one of 8 universities in the country with the full range of undergraduate, graduate, professional, and healthcare colleges on one campus. And we've talked about how important it is to have that multidisciplinary approach to handling not just how we react to the virus, but the research that's going on with COVID. But specifically, having that academic medical center on campus, how vital is that? How vital has it been in the last few months? And then also, as we do reinvent normal, how important is it?
Sure. Well, certainly, we all know what having a regional referral center has meant in terms of saving lives and improving health. The transfers we get from around the Commonwealth and beyond for the most sophisticated and complex care. People wouldn't be able to get that if we weren't here. In a practical sense, though, they're in week 5 of their restart. So what we're learning from them that we can apply to other settings has been invaluable. And the expertise we can draw on when it comes to testing or contact tracing. You go throughout our entire academic health center and you have that kind of expertise. All the things you need to do now, test, isolate, trace, quarantine. We have expertise in all of those areas.
We look at the way our healthcare system in this country has had to face this, and how we've tried to flatten that curve, do the things we need to do to keep those numbers down. Because of that, it has put us in a position where a lot of people have had to work from home, isolate if they can. The people who can't do that are trying to do their best, to socially distance. But we've seen an impact on our economic situation in this country. Our unemployment numbers have skyrocketed, and we've also seen an impact on, I think, mental health. In a lot of instances, we talk about that and how important that is. Just on a personal note, what do you do to try to unplug from some of this, or try to kind of alleviate some of that? It's taxing to be stuck in a situation where you can't communicate or can't congregate with people. So how do you approach those things?
Yeah, I'd say I miss that the most. When I see good things going on and I don't have the opportunity to walk over to a building and personally express thanks or hear what someone has to say, that's such a convenient way to feel connected and express gratitude. So I do miss that a lot. I take solace in knowing all the activities underway at a variety of levels that keep people connected. I know that we've had to do that in lots of different ways. It is hard some days living on a campus that is way too empty. And I would say you struggle on some days. I also recognize at a time when you're challenged like this, I have the good fortune of a strong partner that I can talk through a lot of the things I deal with. And she's a good listener and was a former higher education administrator. She was a dean. So that's been very helpful. I have tried in this environment to maintain my health in terms of exercise and diet and so forth, trying to keep a balance. But I consider myself so fortunate. And I think more and worry more about those that may not have my particular circumstance. I'm so worried now about the parent who has to juggle their work, even if they can do it remotely, and many still can't, who have to now become a teacher during the day, have to entertain children in a restrained way, and keep them engaged, keep their mental health up. Many people have parents. I miss mine. They're no longer with me. But I think back, especially with my mother, who had an abbreviated but still several month path to her goodbye. I know people who are trying to take care of parents within their home or within facilities that they can't go to now. I so feel for the pressures they must have. It's one of the reasons we've worked to strengthen our HR support, emergency funds available to employees and all. In this county, these are remarkable numbers. I think we represent 14% of the workforce. There have been 44,000 and growing filings for unemployment within this county. That means that we are representing even a larger proportion of the jobs. For me, I imagine that many people who lost their jobs, although we've had some good support from the federal government and what we do internally, I think it's been robust. But I recognize that these are the spouses, partners, close to, people who are close to our employees. And our Employee Assistance Fund is available to support you and those close to you, because I imagine the repercussions of this are pretty strong within our employee community. It's another reason we thought it was important to maintain our job numbers. Our work is essential. We need everybody to bring everybody back and doing an even better job at what we were doing. But it's also important. I think we're 18% of the budget in Fayette County, given the taxes, occupational taxes, and everything we pay. And when you're losing jobs, losing tax revenues, you got those vital services. We are enriched by the community of Lexington. So to the extent that they're strong, we remain strong.
We don't want to take up too much more of your time. I know you've got a lot going on. You've had, we were talking before the podcast, you've been in a lot of meetings. You've been talking a lot. We'll wrap this up. But one thing I want to ask, the last thing we'll ask, what has surprised you most in the last few months?
I would say these are pleasant surprises. If you would have, I've read several books. I have one on my shelf that an author gave me 20 years ago when I invited her to be a speaker at a commencement when I was a dean. And she spoke that day and writes and still writes about the consequences of global pandemics. And they were unimaginable. We had warnings with SARS and so forth, but you couldn't fully comprehend the gravity of these things. My biggest surprise is the extent to which we have overcome some of that gravity. We have a long way to go. I think, although people may have criticisms, the magnitude of the response out of Washington, however noisy that may be, when you go back and look at how we responded during the Great Depression, where we missed it, how we left too many people, they were unemployed, but we didn't come with the sort of financial support we have today. I'm surprised that we did that. From the day this started, we recognized the impact it could have on our budgets. And we've been open and transparent in communicating that. And for first several weeks, we were going to maintain our payroll. And we worked hard to do that. And people said, the federal government will not be able to step in with generous ways to preserve jobs or with expanded unemployment insurance. I mean, $600 augmentation a week for people who lose their jobs. I mean, they made that decision within a week's time. So I think the responsiveness there, that surprised me. It's a pleasant surprise. We got more to debate, more to do, and so forth. But all in all, despite some of the tensions this is set up, in many ways, I'm looking for that silver lining. I think it's there of our being a little closer together than we were before.
Well, Dr. Capilouto, I will say that I appreciate your optimism, and I appreciate your leadership for the university during this time. And I think that your experience, your background, to face this, I think we are in good hands to face it with you, and the administrative staff that we have, and the faculty and staff that we have here. I feel very confident about how we put our foot forward, moving into this reinvented normal.
Well, thank you, Cody. It's going to take all of us.
Well, thanks so much for being with us today. We really appreciate you being on the podcast.
Take care. Be safe.